In response to COVID, our government imposed a lot of rules and regulations on the American people. Masks, social distancing, draconian lockdowns. They shut down travel. They tried to cancel holidays and canceled school and professional sports. They also told us who was most at risk of dying of COVID, the elderly and people with comorbidities. During the course of the last year, there were also studies that didn't get much attention from our public officials and that should have been shared with the public because information is power. And one of those studies looked at large disparities in COVID deaths between various countries. In the U.S., we've had over 1,600 deaths per million inhabitants. Italy has had 1,800, but Egypt had 116, and Nigeria under 10. Now, there are many possible factors. Four countries have younger populations. Sometimes their exposure to similar pathogens have primed their immune systems for COVID. But there were other explanations for these disparities. One of them was obesity. Nigeria and Egypt have far less obesity than the U.S. Nearly 80% of the people who were hospitalized with the virus in the U.S. were overweight or obese, according to the CDC. And with more than 42% of our total population being obese, that's a pretty important number. According to the Palm Beach Post, in the United States, coronavirus mortality rates by ethnicity map onto obesity rates pretty closely. But that didn't stop healthcare experts from pronouncing systemic racism as the cause for higher COVID mortality rates among minorities. Now, over the years, our government has spent billions of dollars on obesity awareness campaigns. Many rightly say it's a national security concern because 20% of males and 40% of female recruits are too heavy to enter basic training, according to military.com. Now, imagine if instead of shutting down gyms and locking us inside of our homes with takeout, booze, and Netflix, our government had told us the truth, that losing weight and being healthy could save our lives. Instead, 42% of Americans gained an average of nearly 30 pounds since last year, according to the American Psychological Association. That was a missed opportunity to encourage Americans to take more personal responsibility for their health and wellness. It's also a failure in leadership. Here now to discuss is Jocko Willink, retired U.S. Navy SEAL and extreme ownership author. It is such a pleasure to have you, Jocko. You're the only reason my kids are tuning in tonight. Let's talk about the leadership during the pandemic. How do you assess it?
I think one of the biggest problems that I saw during the whole pandemic, the way it unfolded, was as a leader, you have to realize that you don't know everything. And if you make a guess about what direction you should head in, and it turns out that your guess was wrong, you need to be able to adjust and try something new. And I saw really both sides of the aisle that committed to some sort of theory and then stayed on that path even after we knew that theory was no longer correct.
Right. And the studies that have come out about obesity or the linking and the talking about it in the press has really only happened in the last couple of months. And I'm wondering, all summer long when we were locked inside and they knew these numbers. I mean, it's not like rocket science, right? I mean, it makes sense just even looking at the countries and looking at the obesity rates. Why do you think we didn't hear about that? And why didn't they tell us to get outside and use this as, they talked about the great reset. This could have been the great health reset for America.
Yeah, again, I think that people got locked onto this idea that, what we need to do is stay away from each other. What we need to do is not go out, not be in groups. And they locked onto that idea so tightly that when we started to realize, oh, there's actually another solution that we should probably moving in the direction of, but egos didn't allow that. And people just continued to say what we need to do is stay apart, stay inside. And obviously, it's not good on a multitude of fronts. Right.
It's not too late, right? Because we could have another pandemic. We don't know. Our border is open right now, and there's another COVID strain coming up from Brazil. How do you think Americans should prepare right now? I know you talk so much about personal responsibility and health and fitness. Give your best advice to America right now to prepare for the next pandemic.
I would say it's really obvious, like you said. Get healthy, go out, exercise, eat good food, be on a good diet, and get outside and get healthy. That's it. Pretty straightforward.
It is pretty straightforward. Our government spent so much money on obesity campaigns. I think they just ought to just provide a link to your, podcast, and maybe everyone would just get fit. That would be a lot cheaper, right?
It all starts with discipline, right? It all starts with discipline. Everybody wants some kind of a magic pill, some kind of a vaccine that's going to save them. You need to rely on yourself to save yourself. impose discipline in your life, start eating right, start exercising. Your whole world will improve if you follow that.
You're right. Discipline is the key to life. If you need more advice on that, you know where to find Jocko. He's always online. People love your podcast, especially young boys and young girls. So thanks so much, Jocko, for joining us. It was a real treat.
Thanks, Rachel.
All right. Still to come tonight.